My name's Sienna. I'm an Adult Library Programs Officer here at Shellharbour City Libraries, and I'm here with Rhyle from Harbour Health in Shellharbour Village. So we'll jump right in to sort of what it looks like to seek mental health. So let's say you've been to your GP, you've got your referral. What's the next step?
Sure. I think finding a psychologist can be quite difficult. Often you want to feel kind of comfortable with who you're seeing. So I certainly recommend people to do a bit of research or maybe reach out to people they know. Maybe there's a bit of a recommendation. Sometimes that's really helpful. I think psychologists hopefully will have a website, a bit of information about them. See if it fits for you. And I certainly encourage people, call up and grill us. Call up and ask us a few questions about what we do and how we can help and what's going on and if it's a right fit. Because coming in to see someone for therapy and doing that work together is really hard. So you want to make sure that from the start point that you feel comfortable and you know that it's a good relationship moving forward. So
great.
Yeah, that'd be my sort of recommendation.
Fantastic. And so because there's so many sort of varieties of mental health professionals, how do we know who to choose between sort of a psychologist, a psychiatrist, a counsellor? What should we be looking for?
Psychologists and counsellor may provide very similar looking kind of services. I guess the difference between the two there is that the term psychologist is a protected title under national law and sort of governed by our sort of regulating body, APRA. And so it just means that title comes with a set kind of parameters of qualifications and professional development and things like that restricts it. So that's maybe a bit of a difference between that, whereas counsellor is a bit more of a across the broad term, I guess, or a term that can be used without that kind of governance. So looking with the psychiatrist now, psychiatrist is a different level of qualification and training. So in order to be a psychiatrist, you're medically trained, you can prescribe medications and things like that. And so a psychiatrist will often see a lot more complex kind of mental health presentations. There may be less sort of psychotherapy provided, like the traditional counselling, and they may be tied in a bit more within the hospital setting. So there is differences. Every one of them has their benefit and unique skill set that they might bring that is helpful for people. Again, just do your research, look up what they provide, see whether it's a suitable fit for you, and then sort of call them and decide from there.
Okay, great. Yeah. And your GP will sort of direct you in which direction you
need to take? Hopefully, GPs will have a bit of a network, but certainly in today's world, Googling and sort of researching in that way is going to probably provide you the best information. There's lots of sort of online directories as well, things like Psychology Today, Health Direct, things like that sort of have a profile of a bunch of different psychologists or counsellors that are available. Google's kind of the go for it.
Awesome. And so then what does a session with a mental health professional look like? So for you, a psychologist.
Sure. So initially, your first couple of sessions is figuring things out. What's going on? What's the problem? What's the concerns that you're having, and how can we help and start to treat and support that? In those first sessions, it's really kind of building a lot of that rapport and really understanding where you're at and just having a really supportive space to talk through and unpack where you've been and some things that you've got going on. From there, we can sort of start developing a bit of a treatment plan, an action plan for sort of managing and supporting you, and then it will be about kind of moving towards that. So, setting some goals, identifying some maybe difficult behaviours and challenges that are happening, learning skills to sort of overcome and work through those, and then just kind of continuing that process. And that will look different for everyone. For some people might feel a lot of improvement within 2 or 3 sessions. Some people may feel it takes 10 or more or whatnot. The average sort of varies for everyone, but really that first step is let's talk, meet, support you, figure out what's going on and move from there.
Yeah, and it seems like there would be a lot of emotions involved there. So what do you find people are generally feeling before and during and after their first session?
Yeah, I think naturally pretty anxious. Coming into a setting to meet someone for the first time and unpack all of your concerns is pretty anxiety provoking. So I think if you feel that way, it's probably quite normal. I mean, as a psychologist, it can feel that way as well, right? Meeting someone for the first time. So yeah, that hopefully will settle. You know, we really want to create a nice, supportive, welcoming space for you through your session. I think it's difficult. I think it's really challenging to come in and confront some of the things that are going on for you. So I think some painful emotions will also come up. But ideally and hopefully through the service, it's about kind of creating some hope and future focus. Where are we going with this? You know, what goals are we going to start achieving, and how are we going to get better? And so you might leave hopefully with that in mind, and that might be hopefully positive for you and a positive step. So yeah, moving forward.
Great. And how do I sort of know, or how do you know what professional is right for you? Are there ever times where you might go in and not click with your psychologist?
Yeah, definitely. I mean, I think psychologists are a bit like a pair of shoes. Some just don't fit quite right.
Yeah.
And that's okay. You know, not every psychologist is for every person. I'm not the best psychologist for everyone. And there are some clients that, you know, may be better suited for how I work, and others that don't. And hopefully as the psychologist would help guide you. If that's happening, you know, it's nice to have that discussion together to go, hey, maybe we're a bit off track, or maybe we're not the best fit. You know, how can we support you to get best connected? So I think it really comes down a little bit to your own intuition. Do you feel comfortable? Do you feel like this is the person that can support you to work through some of these challenges? Do you feel like the way that they work and the processes that they go through are actually helpful for you? And if they're not, I really encourage people just to, you know, highlight that, let them know, and then sort of just continue to seek someone that is more suitable for you. It's really important when you're going through this hard, difficult process, helpful process, that you're doing it with someone that you feel comfortable with, and you know, willing to do the work together.
Great. And so the lead up to that first appointment might be quite daunting to a lot of people. What can people do before the session just to make sure that they're sort of a bit more at ease?
For sure. Give us a call and really grill me. You know, really ask me some questions as to what's going on. You know, 10 minutes on the phone can go a long way to just sort of understanding, is this the right fit, and do I feel comfortable here? So I always try and give my clients that opportunity to have a chat beforehand, and sometimes that comes to the conclusion of like, all right, maybe not the best fit, maybe here's a psychologist within my network that I know of that could be better suited for you. So that setup is really important. Other stuff that you can do to really set up that initial session is probably doing the research, checking their sort of website. Do they target these kind of concerns that you might have? You know, if you're seeking someone around depression support, is this a particular expertise? You know, stuff like that. And I would also say that first session, you're going to spend a lot of time talking through what's going on. So have a sit down with yourself, maybe have a coffee or whatnot, and go through and maybe just do some journaling as to, this is where I'm at, these are my concerns, and this is what I'd like to start working on. Doing that will just mean you come in kind of ready to go and with that fresh on your mind. So yeah, I'd encourage those sort of things.
So how do you know what you're going to get when you go into seeing a psychologist?
I think it's really important in that first session that we work together on a treatment plan. You know, what is this going to look like in our sessions and our time together? I find when people, and when I haven't done that at times, when I've missed that, it obviously makes it feel like a little bit, you know, dancing in the dark. Where are we going? What are the next sessions going to look like, and stuff like that. So when we meet, or when you meet with a psychologist, hopefully, and if not, do ask, but you know, certainly put forward, what's this treatment going to look like? How many sessions might we be working together for? You know, what will we be doing in those kind of sessions, that kind of direction? And I think that really goes a long way to making you feel like we've actually got a plan here. And at the end of this plan, hopefully, you know, through the work that we're doing, you'll be feeling better and back towards the life that you want. So
fantastic. Well, thank you so much for joining us today, Rhyle, and we'll put some resources at the end. And that's all we have for today.